Hello, and welcome to the CardioSmart community on CardioSource. My name is Dr. Andrew Freeman, and I'm editor-in-chief of this new site. I'm joined today by Eva Klein-Rogers, a nurse practitioner from the University of Michigan in Ann Arbor. And today we'll be talking about implementing patient-centered care in a large system. Welcome, Eva.
Thank you very much, Dr. Freeman.
So it's my pleasure to have you, and you guys have done some real pioneering work in delivering patient-centered care in a very practical way. And I'd love it if you could share with our viewers a little bit more about what you've done and how it's affected your practice.
Absolutely. So, as you know, patient and family-centered care is all about the patient and family. And in initiating any large change in a health system as large as the University of Michigan hospitals, it's important to have buy-in from the top executives. So our CEO of the health centers is very supportive of this. He's engaged all of the associate directors as well as managers. What they've done is made this part of the culture here at the University of Michigan, and it's really important that we think about it as a culture change. So everyone from every level is involved in involving the patients and families. In addition, there's a more formal structure, and it involves reaching out to patients and family members, asking them to get involved. Not anybody who wants to is selected. There are certain criteria. Certainly, we want those folks that are going to give us some constructive feedback that will allow us to come up with some interventions that will result in measurable, meaningful change.
So tell us a little bit more, just to start to interrupt, but tell us a little bit more about some of the more practical approaches. So you guys have had, 2 or 3 really fantastic, well-received projects. Tell us a little bit about how those have worked and implemented.
Absolutely, and I can give you examples from both inpatient and outpatient. So a good example from the outpatient arena is what's called MD pads, and these are placed in the waiting areas for patients and family members, and it's a way for them to write down their concerns for their upcoming visit. So they can jot down questions, concerns, issues that are bothering them, and on the pads themselves it says endorsed by the Patient and Family Advisory Council. So it's right there and very useful.
So that helps the provider to kind of frame the visit's agenda?
Absolutely.
Perfect.
And taking into consideration patient and family needs. And another example from an inpatient setting is I actually have 2 different examples, and I think they're great examples. One is in our patients who are nonverbal, so intubated, comatose. Their family members write on a board, "What about me?" And just a little brief description describing that person, what their likes are, dislikes, what they did in life or do in life, so that providers who come in and are unable to communicate with them can see that very clearly and are able to incorporate that into their communication with the patient and the family members. Another good example is patient rounding in the room involving the patient and family members. Now, some of our senior faculty are currently doing this and love it. It allows families to be part of the discussion. They see all the factors that go into the decision making, and they play a big part in the ultimate decision making.
So it sounds like, at least with the ICU initiative, you kind of put a face on someone who's not really able to communicate, which I think really puts the patient clearly in someone's forefront. This isn't just Mr. X, this is an accountant who loves to play football or whatever, which I think is fantastic. And then the other one is very intriguing to me. So how do you go about delivering difficult discussions, which often happen outside of the patient's room, with the patient there? So for instance, somebody comes in with some kind of mass of some sort, and they may have cancer, but you don't know it, and you don't want to scare the patient, but you want to make sure they're part of the process. I mean, how do you do that?
Yeah, great question. And I've heard feedback from faculty, both pro and con on that. And one faculty member in particular feels that it's very important to, regardless of what it is, be at the bedside. Say, we're not certain this is how we're going to explore the question further. These are the tests that we need. We won't be able to tell you definitively until this, and this happens. There are others that are not as comfortable, that are still leaving those sensitive discussions for outside of the room until they're able to go in. And in fact, from a family member, and this came from one of the advisory groups, they preferred that the providers ask the patient and family, would you like us to have the discussion here at the bedside so you all can be involved?
Right, and that's one of the first tenets of patient-centered care, is making sure the patient's wishes are heard and the patient's family.
Absolutely.
So I guess I'm a little bit more curious and still very intrigued with this. So do you ever have it when you're in the middle of the room and you're rounding and you're using all your medical jargon, does the patient say, what does that mean? I'm not, I never had asystole. What does that mean? So.
Yes, absolutely. And I think it's great for providers because it reminds us that we need to be addressing patients at their level. And just like in educational materials that we produce, it has to be at a 6th grade reading level. We need to constantly be reminded that we need to be speaking to patients appropriately at their level of understanding.
Right, and one of the big things that's been on the minds of many of the cardiovascular healthcare providers, and I'm sure yourself, is that there's always a time crunch. So are you finding that involving the patient and putting the patient-centeredness back into patient care is taking more time, or is it conversely actually taking less time because care delivery is more efficient?
So 2 comments about that. From the inpatient side, and one of the faculty members who's a very strong advocate for this feels it takes less time because everybody's there seeing the big picture. They now know they will not get a definitive answer until they have the stress test and possibly subsequent cath. Then they'll have an answer. So instead of multiple providers having to answer multiple questions from multiple family members, it's all taken care of right there in the discussion.
Well, I think I was going to say, I think that's fantastic, because what I see is it may take an extra few minutes in the room, but later in the day, it doesn't mean I have to go back and explain things, because we've already explained it and laid the expectations, and hopefully they've been met, and then hopefully there's more buy-in. I bet you probably have family members rush into the room right before rounds to make sure they're part of it. So.
Yes, right, and that's part of the education of the staff, is to make sure families know when rounding is anticipated so that the family members are in the room when that happens.
Well, great.
From an outpatient perspective, it's a little more complicated. One of the tools that we are working on now is a AFib decision tool looking at anticoagulation, and it involves looking at all the risks and benefits, and it includes a pictogram which helps patients and family really see the big picture in making that decision. It takes longer, but it is a priority, and we make it a priority in the clinic visit.
Yeah, and I look forward to seeing some of the data that you probably will develop about how adherent people are to their treatments when they make the decision with their provider instead of the provider making it for them. So
yes.
You've been fantastic. Thank you so much, Eva, for spending time with us today and telling us about how you've implemented patient-centered care in a large system. Continue to tune into the CardioSmart community for more information on the value of patient-centered care. I'm Dr. Andrew Freeman, and I thank you for watching.